Living kidney donation is crucial for narrowing organ shortage gap. About 1/5 of the kidney transplants which occur each year in the United States come from living kidney donors. As the scientific evidence increases, we now know living donation does not come without risks. These risks are more pronounced in African American kidney donors, with the greatest risk of development of post-donation kidney failure. To address these disparities, it is important to understand that there are early precursors of organ damage which can be studied. One of these precursors is estimated glomerular filtration rate. Even small reduction in estimated glomerular filtration rate has been linked to cardiovascular and all-cause mortality. Previously, it had not been studied if there was a difference in early eGFR post-donation in African American and white donors.
To answer this question, we used data from the Scientific Registry of Transplant Recipients and explored racial differences in recovery of kidney function within 2 years of donation. In a cohort of over 100,000 living kidney donors, 10% of whom were Black, we examined the likelihood of recovering 60 and 75% of pre-donation kidney function using logistic regression and Cox proportional hazards regression. We found that male sex, older age, higher preoperative BMI, and higher pre-donation eGFR were all associated with lower likelihood of recovery. We also explored for the presence of effect modification using one-way multiplicative interaction terms, and we found that Black males had the lowest likelihood of recovery of all race and sex combinations.
Our findings highlight that previous living kidney donors who self-identify as African American or Black, particularly men, are at higher risk for not recovering their pre-donation estimated glomerular filtration rate. They also, among those who do recover it, it takes them much longer to actually recover that eGFR, which we know puts them at greater risk for future end-stage kidney disease. Our work, I think, really highlights the need for ongoing post-donation follow-up, particularly for our most vulnerable populations, which include ethnic minorities, like individuals who self-identify as African American or Black. It highlights also the importance of what we need to do as a transplant community to ensure that these individuals have access to long-term follow-up. And I think importantly, it's quite poignant for our team, as we here at UAB have performed more living donor kidney transplants in African American or Black individuals than any other center in the country. And this really reflects our commitment to continuing to understand how we can best care for individuals who have given the most extraordinary of gifts, and that is a kidney for someone that they love. And I'd also like to thank our entire team, which include members not just from the Department of Surgery, but our colleagues in the Department of Medicine and in particular nephrology, Dr. Vineeta Kumar, who helped with this publication. Thank you.